I asked Wits female students to read out untold truths experienced by Wits female medical students who practice in hospitals. None of the Wits female medical students who disclosed their untold truths are shown in this video to protect their identity.
When we have clinical methods, some of the doctors conducting our tutorials will address all the men in our group by name, but will not the women, even though we all have our names on our scrub tops. Wow, that is very rude. That is discriminating women. That's very sexist. Because why would you not mention female names, but when it comes to guys, you're there to mention their names? Personally, I'm sorry that he does not do that, but that was very rude of your tutor not mentioning your names.
Clinical days are so exhausting because I have to work twice as hard to be acknowledged, while I watch my white male counterparts being applauded for just doing bare minimum. First of all, that's racist. And work knows no color. Why does one person have to work hard while the other just does minimum work but be acknowledged?
At hospitals, more often than not, the doctors you're presenting to pay more attention to your male peers to know and understand what's going on. And your male peers sometimes push you out of the way to work on patients. I guess this is the reality for females in the working world. With the doctors taking preference over the guys, it could be a matter of power. Men don't want to give power to women. And as the future generation of doctors coming in, that's not going to change. Whether you're a doctor, whether you're a politician, whether you're a teacher, it's always going to be a matter of male-dominated spaces. And yeah, it's the sad truth, guys.
I'm always scared to be left alone with the male patients because even when trying to help, your safety is not guaranteed.
Women's safety is not guaranteed in any space. I don't know of any space that women can say their safety is guaranteed, whether it be at home, work. And I don't think there's a solution or an easy solution, because how do we get men to make us feel safe? At the same time, we are definitely not the problem. We'd have never had to question or worry about our safety in the first place if there weren't incidences or a train of events that have occurred that have made women feel unsafe. I mean, things happen right outside, next door, opposite a police station. So really there is no safe or in any area of being guaranteed safety. That just goes back to how, I guess, men are exposed to women and how their environment has enabled them, because most men I interact with say the reason they have grown or been the men that they are is because of the environments that they were surrounded in that built or highlighted certain things around them. So I guess that's there is no space safe. And that's deep for me as a doctor, that you're in a space, you have the tools to really help people, but you can't even fully help them because you are still worried about your safety in doing that. Then that hinders you actually being capable of helping someone else.
Being black doesn't also help because patients mistaken you for a nurse, besides your full attire and name tags. White people will always be the preferred doctor to you because they know better, despite your hard work and knowledge. And at most times, you probably know better than them. Yeah, I think, systems look to rule out black people and black thought and black knowledge. I think it's been entrenched in systematic racism where your skin color automatically disqualifies you. It's just sad that it's still ingrained in the mentality of people. That's someone's reality, that's someone's lived experience, that's someone's daily experience. Yeah, I just think a lot needs to be done.